So how do we assist Medicare beneficiaries with their drug needs in 2024? We confirm their current and future enrollment in either LIS, Medicaid, or QMB. We help them log in and assess what their current Medicare drug coverage is. We analyze their plans for 2024 to see what will be the best plan. Maybe it's the plan they're in, maybe it's a different plan. If it is beneficial to change, we will enroll the Medicare enrollee into a new Part D plan online. We could also do it by telephone, but generally we do it online through the Medicare.gov Plan Finder tool. And then in consultation with your mentor, help advise clients who are in plans that are not working, but who also may not be able to change plans at this time, or maybe there's not a good other option. There are some things that we can do in those situations, at least in terms of providing advice to help people with their plans, or with their medications, I should say. So I'm actually going to skip over the next few slides. The next few slides talk about creating a MyMedicare.gov account. MyMedicare.gov was new several years ago, and we had a big push to create accounts for all of the people that we assisted with. By and large now, I think the vast majority of people that we assist through this project already have MyMedicare.gov accounts. If you happen to encounter someone who does not have a MyMedicare.gov account, you can talk to your mentor through Legal Aid or Walker, and they will be happy to assist you with that process. But I think it's very unlikely that this will come up for the vast majority of people this year. So I'm going to skip those slides. And instead, what I'm going to do is talk about how to conduct a general search in Medicare.gov. So the personalized search that someone can use when they have a MyMedicare.gov account, that's how you do sort of the personal search, where you see what plan that person is enrolled in, what medications they've been taking, and you can do that kind of personalized analysis for 2024. If someone doesn't have a MyMedicare.gov account, perhaps they don't want to create one, or if they're having trouble logging in to their MyMedicare.gov account, you can still do an analysis for that person by doing the general search. And there's a couple of screenshots in a minute that'll kind of walk you through how to do that. But there's a way essentially to continue without logging in. Doing a general search, you do need to have a little bit of information about the client's prescription drug needs. Obviously, you need to have their list of medications, because you will have to enter that list of medications manually. There will not be the personalized information that you will be able to access through MyMedicare.gov. And then you would also need to put in the correct information to ensure that you are reflecting whatever level of low-income subsidy or cost sharing, whether it's QMB or full Medicaid, that person has, so that you can give them an accurate recommendation about what drug plans will cost for 2024. And as it says at the bottom, you can use this general search process if the login fails, or if sometimes you can log in, but maybe there's confusion or it doesn't reflect someone's correct LIS or QMB status. And so you can use the generalized search for that purpose as well, to get a more accurate sense of what their costs will be for next year. In order to conduct a generalized search, this is a screenshot of the kind of login page on MyMedicare.gov. On the left, you will see that that's how you would log in for someone with a MyMedicare.gov, but on the right, you can continue without logging in. You'll want to select the year that you are doing coverage for, or doing an analysis for. In this case, it would be 2024, and then you'll enter the zip code for the person who you're assisting. When you're conducting a general search, the other thing that you would need to do is to, again, like I said, make sure that you input the correct amount of extra help or low-income subsidy or QMB that person is receiving. So if that person has QMB, and I think that's not on this, I'm sorry. But if the person has QMB, there will be an option to select the Medicare Savings Program before you continue on. If the client has QMB and full DC Medicaid, then there's an option to select Medicaid. If the client happens to get SSI, which is a disability benefit through Social Security. That's supplemental security income. There's also an option to select supplemental security income as the extra help that that person receives. If you are trying to do a generalized search and you have any questions about this, or you're not sure which one of these to select, that is an excellent time to speak to your mentor, because they can certainly help walk you through that and help figure out the best way to run a generalized search for the client you're assisting. After that, you will be at the same spot in the plan finder as you would in the search. You'll have to enter someone's medications. You'll have to select which pharmacy they use, and then it will send you on to all of the plans for 2024 and let you compare and contrast what those options are. So this is just kind of an overview of all of the different ways in which Medicare Part D enrollees who do not receive extra help, all of the different costs that are associated with Part D coverage. First, there is a premium for every Medicare Part D drug plan. In 2024, in DC, those will range from a minimum of 40 cents per month to a maximum of $113.40 per month. There will be a benchmark of $41.29. The Medicare Part D premium benchmark is the amount that sets where a plan is considered to be low-income subsidy plan. So a plan with a Medicare premium less than this benchmark is generally considered to be low-income subsidy, although there's a couple of little exceptions to that. So if someone is enrolled in a plan with a subsidy, with a premium over $41.29, even if they are enrolled in the low-income subsidy, they will still have to pay the difference between $41.29 and that Part D plan's premium. But it does obviously reduce it substantially. There is a deductible of $545 of total drug costs. The enrollee will pay 100% of that cost. But again, someone who's enrolled in low-income subsidy or QMB does not have to pay that deductible. During the initial coverage period, the enrollee is responsible for 25% of the cost of their medications. The initial coverage period is when medication total cost is between $505 and $5,030, and these amounts change each year. There used to be this donut hole that I referred to. At least for now, that donut hole is not there anymore. The enrollee still gets a 75% discount when drug costs are between $5,030 and $8,000. So they're still essentially paying 25% of the cost of their medications when their drug prices reach that level. When drug costs go above $8,000 in the course of a year, that is considered the catastrophic coverage phase. Beneficiaries will pay either 5% as a coinsurance instead of the 25%, or they'll pay these copay amounts if they're receiving extra help. But again, the good thing about the low-income subsidy and the QMB program is that virtually all of these cost-sharing mechanisms that are built into Medicare Part D are paid for, except for these limited copays when someone has that extra help. So that's why, ensuring that someone has their low-income subsidy and QMB in place now, or even Medicaid if they qualify, having it in place now and making sure that it will be in place for the next year is a critically important part of the analysis that we do. And I mentioned earlier that people who receive the low-income subsidy or QMB are able to change their plan with a little more frequency outside of the open enrollment period. Several years ago, I think up through maybe 2018 or 2019, it used to be the case that they could change their plan any month. They could change their plan at any time in the year, and that plan change would be effective the first of the following month. That rule is now a little bit more restrictive than it used to be. For the first 3 quarters of every year, enrollees now who are in the low-income subsidy are able to change their plan once per quarter, but only once per quarter. And that plan change will be effective the first of the following month. So, as an example, Clara changes her plan from Plan A to Plan B on January 15th. She'll be enrolled in Plan B effective February 1st, but she cannot change her plan again until the following quarter, which would start on April 1st. In the fourth quarter of every year, people are only allowed a plan change between October 15th and December 7th, with that change occurring or becoming effective, I should say, on January 1st. So as an example, Clara changes plans from A to B on October 15th of 2021. She will be enrolled in Plan B effective January 1st of 2022, because that was done during the open enrollment, and the open enrollment changes are effective the first of the following year. So if Clara tries to again change her plan in this quarter outside of the open enrollment, this is example 2, let's say she tries to again change her plan on December 20th, her enrollment may appear to go through on Medicare.gov, but it's going to be rejected by Medicare. And she won't be able to change her plan again until after the new year. So, and again, if she has low income subsidy, she'll be able to change her plan again after January 1st, but that change isn't effective till the first of the following month. So that's why we want to make sure that we're doing the best we can to find the best plan for folks for next year. So hopefully they don't have to change their plan at all. But if they do, it can be a little bit of a hassle for that month of January in terms of their coverage options.